Dimples are considered a sign of beauty and perfection, and in some cultures, even good luck and good fortune. They tend to accentuate a smile, thus increasing the perception of attractiveness and facial beauty. People with dimples, they look charming and adorable, but unfortunately only 20% of the population have it naturally. But don't be disheartened. Dimples can be created surgically with a daycare procedure lasting about 30 to 45 minutes. Natural dimples are a result of a defect in one of our smile muscles, which is called zygomaticus major. Some of the fibers of this muscle, they're attached to the dermis, which is the underlayer of our skin. And so when this muscle contracts, the skin is contracted and pulled up and a dimple is formed. So for dimpleplasty, the first and the most important step is the location of the dimple. Most often it is marked as per the patient preference. But if we have to decide, it is mostly decided by asking the patient to suck the cheek inside like this, and the point of maximum hollowness is marked as the point where the dimple is created. There are other methods in marking as well, but this is the method which is most preferred by us, and it gives a very natural looking dimple site. Now the procedure, when we start, an incision is given on the inside of the cheek, inside the mouth, at the exact site where the dimple is planned. So when we start the procedure, an incision is given around 5 millimeter to 1 centimeter size. Incision is given in the mucosa on the inside of the mouth at the exact site where the dimple is desired, and the dermis at that point is sutured to the underlying muscle. So this kind of replicates the effects which is similar to the natural dimple. Absorbable sutures are used and the incision is closed. So since the entire procedure is done from inside the oral cavity, there is no scar on the outside. At the end of the procedure, you get the dimple you had long desired. If you want it bilateral, the procedure is repeated on the opposite side in a similar fashion. The patient is discharged in a few hours and he can resume his normal activities from next day onwards. He is asked to take semi-solid or liquid diet for a few days so that the discomfort is less. Swelling and bruising, it increases over a period of 48 hours and then starts decreasing over a couple of weeks. Most of the swelling disappears by a couple of weeks, but the entire swelling takes about a few months to subside. Now, one thing which you need to remember is when we create a dimple, it is initially static in the first couple of months, which means the dimple appears even when you're not smiling. It is always there. But don't worry, it gradually becomes dynamic and over a couple of months, it starts appearing only when you smile. A simple procedure leaves you with an alluring smile which makes your face light up and look younger. A smile which wins millions of hearts, a smile to die for. So book your appointment now. Thank you.